One of the things that's talked about occasionally, or that I talk about, is the expiration of medicines. Now, it is my belief that, many medicines have an expiration date on it. I'm not encouraging you to use your medicines beyond the expiration date, but I think that that is a major hoax which has been created by the government and drug companies so that more will be manufactured. I think that very few of these medications lose their potency in 3, 5, 7, or even 10 years or more. There was a study done in 1987 that showed a certain percentage. Those medicines are hardly around anymore. That test needs to be repeated. And I guarantee our President Obama, he would save billions of dollars if he had the expiration dates moved out. In addition, patients who've been on a medication for more than a year should be able to receive 6-month or 1-year refills at one time instead of having to go back to the pharmacy every 30 or 90 days. That just encourages the patient to go back to the pharmacy and then spend money. And I know that we are trying to get a stimulus package so that people will spend money, but I don't think we need to do it unnecessarily and force people into that position by only giving them 30 days of prescription or even 90 days when they could give them at least a 6-month prescription supply if the patient had been on that medicine for more than a year. If you have hardening of the arteries in the neck here, that's called the carotid arteries. And if you have hardening of the arteries in the carotid arteries, then if you really get the blood pressure and cholesterol down, this hardening of the arteries in the neck progresses ever so slowly. So you could have relatively advanced hardening of the arteries and still no need for surgery if the doctor gets the non-HDL cholesterol. Okay, who knows what non-HDL cholesterol is? That gets the non-HDL cholesterol down to 90. Remember, when you subtract the good cholesterol, the HDL, from the total cholesterol, then everything else left is all of the bad, and that's called the non-good cholesterol, all of the bad, non-HDL cholesterol. And so that's what I think you need to get that number down to 90. There is information about more sophisticated tests called ApoB and ApoA1 ratio, but I still think that the non-HDL cholesterol is a very good substitute. For those of you who have high cholesterol and at the present time are unwilling to take Lipitor or Crestor, and you can even take Crestor once a week, or Zetia or Vytorin, those are the really effective medications for lowering cholesterol. The generic Zocor not only has, that's called simvastatin, not only has more drug interactions, it's also simply not as effective. It's better than nothing, but what I'm coming to is red yeast rice, which is the natural form of this class of statins, actually was studied and found to reduce the incidence of heart attack in that study. Reducing the cholesterol dramatically to that non-HDL cholesterol of less than 90 also makes the blood vessels more elastic. They tend to truly get fixed and hard and become pipe-like, and they're supposed to be like this. They're supposed to be elastic and expand, and when you get the cholesterol really down, you sort of take that pipe-like structure out of them, and they get better. Here is the article that says when you give Crestor, it actually, in adequate doses to get that non-HDL cholesterol less than 90, it actually causes reversal of hardening of the arteries process, which was thought to be nonsense, but it is not nonsense. It has been well known that the hardening of the arteries process can reverse. Heart attacks and blood viscosity, that's thickness, can be reduced by blood donations. And so I think it's a good idea not to have a hemoglobin, a red count, above 14, because that means more red blood cells and they get too thick and they start to clump together and increase your risk of heart attack. Now, why did I green home trick tips? This is about, efficient high performance windows. Insulate the ducts in your house so that they don't leak heat. I walked down a couple of years ago in my basement during winter when it was very cold and my furnace was on a lot. My basement was very warm, And immediately I understood, because the heat was running and the ducts had no insulation around them, that all the metal was radiating heat into the basement. Well, I had my ducts insulated. Wasn't cheap, but my basement is not nearly as warm this year when it was very cold. Efficient water heating equipment, efficient lighting, efficient appliances. But the main thing I told you was about insulating the heating ducts. Here is a medication that has been found to be a benefit for people with Alzheimer's disease. It's called Dimebon, D-I-M-E-B-O-N. And let's see, I think it used to be around for other purposes, but I don't really remember. Dimebon, let's see. Oh, it's an antihistamine in Russia, so that may be a benefit. Here is a product, a natural product for enhancing mental function, and it's called, what did they call this? The name of this, 3C, Sense of Mind formula, Sense of Mind. And I think, yes, Sense of Mind. Here's the 800 number if you want. It certainly is not cheap. 6-month supply for $124, and it's made by North Star, Northstar. Their toll-free number, if you want to check it out, is 800-537-9687. I've already mentioned a medication once about enhancing the benefit of cholesterol reduction, and that is Zetia, or ezetimibe, and that was recently found to inhibit the growth of blood vessels in cancers, and that is a good thing. But there was a question about whether or not it actually increased the incidence of cancer, and the studies so far do not support such.